Hello. I'm so glad to have you here with us today. I'm having a friend of mine, a doctor colleague. Her name is Noha Polack, joining me today. She's a pediatrician and she's going to talk to us about weight loss messaging with our teens. So I'm thrilled to talk about this today. I have kids of my own in teens and 20s, and a lot of my clients ask this. I have a 12-year-old and I'm trying to lose weight because my blood sugar is up. How do I talk about this in my house without it being diet culture? Just messaging in general because of where we are in 2023. There's a lot of issues that come up. So thank you so much for being here today, Noha.
Thank you so much for having me, Heather. What a pleasure. Thanks. I'm very passionate about this topic, so I love talking about it. I've been a pediatrician. I've been practicing in New Jersey for almost 30 years now. So it's been a bit. And I've kind of gone through all of the phases, I would say, of how we were talking to kids 30 years ago, 20 years ago, 10 years ago, and now. To be honest with you, Heather, it's really different.
Oh.
Yeah, 30 years ago, you'd see an overweight kid, you'd immediately go to the BMI chart and you'd show the parents and you'd tell them, you must get them to this weight, blah, blah, blah. And it's really reversed, to be honest. And I feel like in medicine, we are learning a bit about how our messaging does need to change and evolve with the times, and that we need to learn from what we've done, whether it's right or wrong. So I practice differently now, to say the least. And that, when I see a kid who is having some sort of a weight issue or a body image issue, we usually try to get to the bottom of it before we give diet advice. And then we let the patient kind of lead the way. And I'm hoping that parents are also doing something similar in order to help, especially really fragile teens, to be honest, not focus only on their body image, but on their health.
Yeah. And we get that it's difficult because as parents, we get anxious about body image, but we also get anxious about weight, right?
We do. And wow, what a great point. I was going to make that point, Heather, because, when I look at my children and I'm worried about their weight sometimes, I have to kind of check myself. Am I worried about how society will see them? Or am I worried about their health truly? And if it's only about how society will see them, then I kind of have to think to myself, hold on a minute. Are you kind of, contributing, in any way to the body image issues of other people around you? So kind of check ourselves as parents, right? Not just as professionals, but as parents. Why are you so scared of your child being overweight, right? And if it's about how society will see them, then it's time to deal with society, frankly, not with our kids, right?
Right.
Right. And if you are truly worried about your child's health, that's when you should go to your doctor and check their hemoglobin A1C, make sure they're not pre-diabetic, right? Because if they are pre-diabetic, then you have something to work on, right? How do you, get them out of that pre-diabetic zone? If they have a very high blood pressure or cholesterol, that needs to be addressed. And I think kids are much more likely to, respond to small changes when it comes from a place of, why don't we get this number that can affect you in 20 or 30 years down into the normal level? What are your thoughts?
No, I agree. And I think sometimes even when we stop and say this is about society, we have to remember that we grew up in the 80s or 90s. And so society is also like lurking in the corners of our own brain, even if we would like to think that we don't think that way. It's part of the water we swam in growing up. So, sometimes that judgment is in our own minds, even if we want to reject it.
Absolutely. Just recognizing it is helpful. I don't think it's possible to totally be judgment free, to be honest, Heather, right? We all have that. But sometimes if you recognize it, you say, oh, wow, look at that thought that just popped into my head.
Right.
That's an interesting thought. Why would I think such a thing about a person? I know for a fact that this has nothing to do with their ability to control themselves, or their eating habits or with any laziness. I know a large number of people who struggle with their weight, who are very active people.
Yes. Yeah.
like runners and swimmers, and they struggle with their weight. So I know for a fact laziness is not an issue. The majority of people who struggle with their weight, I know they definitely have self-control. They're busy professional people. People don't become busy professionals by having no self-control, right?
Right. To being lazy.
Exactly. So all of those thoughts that sometimes pop in our heads, if we recognize them, our children will understand that, oh yeah, mom does kind of check herself. You know, she will have a thought and she'll be like, oh, that thought was not a cool thought. Let me check that thought.
Yeah. So it's nice to share these things if they come out loud, right?
Yep. Exactly.
Nice.
Yeah.
So how do we do this, kind of day to day in our homes? Like tell us more about messaging.
Yeah. I mean, I think honestly, it's an evolving messaging situation, in my opinion, and I'm learning every day. So I would say that both as a parent and as a professional, to first of all, give yourself grace. You're definitely going to say the wrong things sometimes, right?
Yeah.
We all do, and we all will. Number one. Number two is, if you are a busy professional woman and you are on a weight loss journey or on a health journey, it's good to put it into perspective in front of your children, especially to say, I'm going to do this because I want to be able to move in this way. I want to be able to dance for an hour, or I want to be able to, go on a hike for a couple of hours without being out of breath, rather than saying, I want to get to this weight so that I can get to this size jeans. You know what I mean? Make it about a functional goal rather than a physical body image kind of a goal that can really help our kids get out of that, diet culture mentality. We all grew up with, like you said, Heather, in the 80s and 90s. So I like to do my best to make it about function. What am I not able to do now that I would like to be able to do later? Number one. Or if there's a health issue, like you and I were talking about a few minutes ago, if someone's diabetic or pre-diabetic and they want to be out of that zone, then that could be something you say in front of your children. So if you're trying to lose weight and changing your eating style, when you're in your discussions, just make it about either function or a goal that has nothing to do with a body image. That's one way to do it. And another thing is to watch out for Instagram and Facebook, right?
Yeah.
I mean, I don't know about your feed, but my feed has lots of food.
True. Yeah.
Not just pretty things, but lots of food on my feed. So, and to be honest, I kind of enjoy it, right? I enjoy looking at it, right? And sometimes it makes me a bit hungry. And sometimes I have to recognize, you know what? I've been scrolling for like 10 minutes and I'm hungry because I've seen all of these videos of people making delicious food. So maybe saying it out loud, saying, oh man, being on Instagram and seeing all these food videos makes me hungry. I'm just not going to do that for a while. I'm going to see if I can put down the phone and do something so that I don't feel so hungry. And just recognizing it. Watching food videos make you hungry, even if you're not really hungry.
Yeah.
So I would say that those kind of clues. So what parents struggle with in my practice, Heather, is when they see their child gaining weight actively, putting 5, 10, 15, even 20 pounds, especially those first couple of college years. Often parents come in with true anxieties about their kids' health, and they sometimes use, threats, to be honest. If you don't change your ways, you're going to have this just like grandma, or you're going to get this thing happening to you, whether it's diabetes or some heart attack or whatever. And the kids really do take that on as a stressor. So as women, as women, we need to watch what we do say and to recognize where we're coming from. Are we coming from a place of fear or a place of help?
Yeah.
Right.
How do you know that?
Well, you can tell by your own blood pressure, my friend. Like all parents, we are deathly afraid of something happening to our child, right?
Yeah.
Yeah. So, but that doesn't mean that every overweight child is going to have diabetes. I mean, the active ones probably won't.
Yeah.
right?
Right.
So I would say to, first of all, ask yourself, where is this messaging coming from? Is it coming from fear? If it's coming from fear, then frankly, it's on you as a parent to control your own fears,
Yeah.
not on your child. And then secondly, to make your messaging about function, what's going on, what's happening in the food court at college or in high school. What are the choices? How can I help you? Can we change your meal plan? Do you want to move into an apartment where you can cook more? Right? Rather than, what's happening. And is midnight the time that you and your friends hang out and that's when you guys are eating? And if that's the case, then we got to manage that a bit differently, right? But I would say that trying to steer your child at any age into making a change in their lifestyle often backfires by increasing their stress level and making them more likely to eat unhealthy foods.
What if you don't want to talk at all about weight with you when your college kid comes home? You notice their body has changed. They look heavier. Is that a strategy too, or do you think it should be addressed?
I personally think you should respect your child and their autonomy and allow them to learn. Everybody knows how to step on the scale and how to look in the mirror, right? Your child is not blind. They know what's going on. So when you're about to blurt that out, maybe you should just honestly check yourself and not say it. I totally agree with you. I was coming from a point of patients that are actually bringing their college-age kids into the practice. And
Well, I don't do once. Yeah, and I don't want to say even that either way is right or wrong, but I just wanted to ask if it was okay for those of us who feel like maybe I shouldn't say anything at all, if that was also okay.
Oh, I think it's very okay. And to be honest, I think that's my strategy.
Okay.
That's my strategy of choice as a person, but not everyone can do that. Again, giving yourself grace is a good thing. I can step back and say, I know for a fact that my daughter knows how to look in the mirror. My son knows how to look in the mirror. And
we know if their pants are too tight and they have to buy new clothes, right? Yeah.
And I also know that I have given them the tools to make changes in their lives. Like have confidence in your own parenting to realize that they will get back on the rails eventually if that's in their genes, right? We also have to recognize DNA and genetic differences in body size and shape as a factor. So, if one side or the other has very large people, then your children may or may not change their body shape. But regardless of that, helping them move well, right? Whether it's through physical therapy or training of some sort is probably a good option.
Yeah. Can we have teenagers, I have a teenager who likes to eat out a lot with her friends. They all work. Some of them don't have family dinner at home, so they love to go out and eat together. And how do you talk to kids about, the one thing, I'm a big vegetable person. So with my teen, I'm like, you still need to eat vegetables every day, allowing that I want her to be able to go out with her friends. But there's also things like the sugary drinks and all that. I know sometimes we don't bring these things up until we notice a weight gain. How do you manage that kind of stuff?
By modeling it.
Okay.
Right. To be perfectly honest. And also I would say that if someone asks you for advice, that's when they will accept it. Unsolicited advice is often not accepted, especially by teens and young adults. If you have an 8-year-old, you're a little bit more likely to be listened to with unsolicited advice.
Right.
But if it's unsolicited advice, unless you're truly modeling it yourself and you pick the right moment, right? You know very well how easy it is to turn off a teenager.
Oh, yeah.
Right?
Yeah.
So I would still say tread carefully and understand that as a parent, you're not in control of everything and you cannot control everything.
Right.
You just can't. Yeah. Right? Giving them autonomy.
Yeah. Because I'm always been a nutrition person. I've always talked nutrition with my kids. And even, obviously I coach people for weight loss. So one time I asked my daughter who'd eaten out a lot that week, I said, are you getting some vegetables at these places you go, or are you eating a vegetable at home? And you know what she said to me?
Mhm.
Don't worry, I'm not going to gain weight. And I thought, I want to share that with people because it's even when I wasn't thinking about weight, I was really thinking, is this kid eating any vegetables or is she only having hamburgers and chicken sandwiches? And that I was so glad she shared that, so that I could say, no, really, remember, I'm the vegetable mom. No matter what you do, I'm always going to talk about whether or not you've been eating vegetables this week.
That it's not always about your weight, right?
It's not. Yeah. But then I thought, like you said about autonomy, that maybe I need to shut up more because she's 17.
But that's a really hard thing for a parent to do, to be honest. So I acknowledge how difficult it is, number one. I also acknowledge that I will certainly blurt things out as a parent. And sometimes I take them back. And as parents, it's good to know that. The kids even notice if you do blurt something out and then you say, oh, that was such the wrong thing to say. I'm so sorry. That's not okay. Then they understand that, okay, you're human too. You're going to make mistakes. It's okay.
Yeah. And it's so beautiful. I mean, you repair the whatever it was that came out. Even you can repair those things.
You can. Instead of beating yourself up about it. Our kids are living in unprecedented times, Heather, right? So first of all, there's much better healthcare than when we grew up, right? And much better than when our parents grew up. Whether they are a little overweight or a lot overweight, there are many things we can do to make them healthy without having them focus on their body shape. So we don't need to advocate for unhealthy eating. I would never do that, right? But what I would advocate for is number one, body autonomy. You're responsible for your body, not that person on Instagram who's telling you how you're supposed to look.
Yeah.
Okay, number one. Number two is nutrition and movement are the most important predictors of health and longevity, not your BMI. So eat good nutrition, move as much as you possibly comfortably can.
Yeah.
And if our kids are having good nutrition and moving as much as they can, some of our anxieties should really be allayed, right? As parents.
Yeah.
Right? Because I would like my kids to live happy, long, healthy lives, regardless of their body shape. And that will help me with my own anxieties if I see them gain weight.
Yeah, I love that. And I love what you said about modeling too, because, we say this over and over again about everything with kids, right? They will actually do what you do and not what you say. And I had on the positive side, my college kid came home and said, I started eating salad sometimes because she was on a off-campus program and the family that she stayed with ate salad. And she was never a salad eater, but she said, well, everybody else in the family eats salad. And I thought, well, it's the only vegetable. I'll eat it. And that was just from modeling, right? I never said she had to eat salad or anything, but
that's amazing. Amazing. It's amazing how when my college age daughter, one time I went to the supermarket with her and I looked in her shopping cart and it looked just like mine.
Beautiful.
And I was like, wow, look at that. It's okay. I mean, I guess over 20 something years, things trickle in. So just modeling it. And then, also one last thing I want to say, Heather, is that, having that rule in your mind that you're going to eat most of the time for nutrition and some of the time for pleasure, and that's okay.
Yeah.
Right.
Yeah.
So even modeling that is okay too, that, I'm going to eat most of the time for nutrition and for, fueling my body with good things. But once in a while, I really want that ice cream cone and I'm going to have that. I'm not going to have it every day, but I certainly will allow myself to have that ice cream cone or that piece of cake for pleasure. And that's acceptable. Nothing to feel bad or guilty or ashamed of. It's good.
Right. I totally agree. And even if you look at the blue zones, people, who live to be, all those communities that have the most people who live over 100, they have dessert a couple times a week. I mean, people are worried. I like to remind them of that.
Yeah.
So that's very,
Absolutely. Absolutely.
well, thank you so much. This has really been helpful. What should we take home from this?
I think we should take home number one is to recognize where our worries about our kids' health is coming from. Is it about their body size because of society or because of their health? If it's because of their health, please address all health concerns, right?
Yeah. Yeah.
Model good, healthy behavior. Don't label food good or bad, right? It's all food
Right.
and you'll get something out of all food. And to just check your thoughts, right? What are your thoughts when you are seeing either your child or someone else who's struggling with their weight, and recognizing that if there's any bias there, to check it.
Yeah. That's beautiful. Thank you so much for sharing this with us today. My clients talk about this all the time because they're, have reasons that they've decided they want to lose weight, but they have, and a lot of them do have kids in their teens and 20s at home. And so they, worry about messaging and having a healthy, mental healthy home, food healthy home, all these things. So
Absolutely. Thank you for having me. It's been such a pleasure speaking with you.
So tell us, I want everyone to know that I will have Dr. Polack's information in the show notes so you can find her. But please tell us now for those who are just listening.
So I love to speak about this topic. And besides being a pediatrician, I am on my way to becoming a public speaker about this topic of messaging regarding body size and, weight. So if you'd like to have a speaker or if you want to contact me in any way, you can find me on LinkedIn under my name, and I'd be happy to have a conversation about that. I also have a website, which is drpolack, drpolack.com. And that's my speaker website.
Super. Thanks again.
It's been a pleasure. Thank you.